$46 million. A sum this large doesn't seem that hard to keep track of. Well, recently, a deficit this size was discovered in the UC Student Health Insurance Program, leaving undergraduate and graduate students wondering what's next for their health coverage. Beginning in 2010, pressure from the UC Office of the President came down on all UC campuses to participate in a system-wide health plan, with a threat of fines for not joining. UC Berkeley was one of the last campuses to join the plan, finally adopting SHIP in the fall of 2011, with the promise of coverage variation for individual campus needs.
Though last fall they started doing a deeper dive analysis and realized that the plan was actually not financially performing, that students loved the new UC SHIP plan and were utilizing it in high volume, and by January of 2012 the plan was actually running a very large deficit system-wide.
The program's management was outsourced to the actuarial company Aon Hewitt, hired by UCOP to keep track of health claims. Who is to blame for the deficit?
Blame is a tough word, I think. As I mentioned before, it became clear as UC SHIP progressed through the last couple of years that the actuaries set their projections lower than what was necessary.
It's been quite shocking that, in January was the first that we heard about how large this deficit was, and that OP wasn't keeping better track of the claims every year and projected surplus or deficit, and that we've actually been getting incorrect information for the last 2 years.
SHIP is now being handled by a new company, and UCOP is pursuing litigation with Aon Hewitt. When CalTV reached out to the firm, they declined to comment.
For now, what to do about the deficit is on hold, and the UC SHIP Advisory Board will address that in the next academic year, not for the coming 2013-14 year, but for the following year.
Although the size of the deficit has decreased from a previously thought $57 million to $46 million, this isn't consoling students.
The reality is that something's going to have to change on the student health insurance plan. By all accounts, the reports from UCOP and the actuarial firms say that our premiums are just set too low, and so if we don't do something about that, our deficit will continue to grow.
Bahar Nawab, Graduate Assembly President and SHIP Advisory Committee Representative for Berkeley, along with the ASUC, have tried to take action by passing resolutions stating students should not have to repay the deficit, but that does not guarantee a fee-free future. Nawab and Cal's Executive Director of Health Services, Claudia Cavello, have been conducting forums and a survey collecting opinions on changing the program. The options include raising premiums, reducing benefits, or pulling out of UC SHIP altogether, leaving students to find coverage in accordance with the Affordable Care Act. On February 20th, students rallied and brought to light that the current SHIP plan does not align with Obamacare because of its caps on lifetime medical coverage and pharmacy costs.
If you get a serious or life-threatening illness, that insurance company can't all of a sudden say that you can't be covered anymore. And as it stands right now, there are about 160 students that have either crossed the caps on medical coverage or on prescription coverage. So the UC Office of the President was considering making student health, sacrificing 160 students to save costs on healthcare shows that the priorities are a little distorted.
Omid and other members of the Student Workers Union have begun a petition and sent an open letter to the Obama administration, asking them to force the UC to comply with federal standards in 2014. University Health Services is still asking students to weigh in on their web survey before Berkeley and other campuses make a decision on SHIP's fate May 1st. For CalTV in Oakland, I'm Ashley Morgan.